there's a lot of comparisons between ulcerative colitis and Crohn's, but they are not the same, and they don't always have the same symptoms, same treatments, and some of the consequences in one are not the same as the consequences in the other. We're going to talk today about Crohn's only. Crohn's is a chronic inflammatory disease. It's usually in the small intestine. It can be the colon or both, but usually the small intestine. Crohn's disease is slow, progressive, and unpredictable. They do have exacerbations and then times of things settle down. There's nothing, oh, I do have a little video I can show you. And actually it's pretty good. That's why it's here. I forgot I had that. And we'll talk more.
What is Crohn's disease? Crohn's disease is a chronic condition characterized by inflammation in the gastrointestinal or GI tract, which is also known as the digestive tract. Since Crohn's disease is a chronic illness, it is persistent and will be present throughout a patient's life. However, patients and physicians can work together to manage the symptoms of this disease. The GI tract includes the mouth, esophagus, stomach, small intestine, large intestine, and anal region. Crohn's disease can affect any part of the GI tract, but the most common location is the last part of the small intestine, which is called the ileum, and the first portion of the colon, which is also referred to as the large intestine. Current thinking is that Crohn's disease is a genetic disease caused by abnormal regulation of the immune system. The GI tract is frequently confronted with bacteria from our diet and environment. Many factors can contribute to a person's risk of having Crohn's disease, but most can be thought of in three categories: genetic predisposition, environmental factors, and a dysregulated immune response in the GI tract, which causes inflammation. Environmental factors that may contribute to Crohn's disease include infections, smoking, and taking antibiotics or anti-inflammatory drugs known as non-steroidal anti-inflammatory drugs, or NSAIDs. One way that the body can protect against potential bacterial threats is with inflammation. We are familiar with how inflammation looks on the outside of the body, for example, when you have a scrape or a cut. That scrape or cut becomes red and inflamed as a result of the immune system trying to get rid of any bacteria and viruses that are in the wound. After a few days, when the immune system has finished its job, it turns off, so the redness and inflammation disappear. In Crohn's disease, inflammation, ulcers, appear within the GI tract, and the immune system works to combat the bacteria and viruses in the same way as with a cut on the surface of the skin. However, the difference is that the immune system is not able to turn itself off after it has gotten rid of the bacteria or virus, so the ulcers remain until they are treated with medicine or surgery. This chronic inflammation is what causes the symptoms of Crohn's disease. The symptoms of Crohn's disease vary depending on where the disease is located and its severity. This means that every patient with Crohn's disease experiences the disease differently. Most patients with Crohn's disease have abdominal pain and diarrhea. Other symptoms related to the GI tract can include abdominal tenderness, loss of appetite, weight loss, fever, fatigue, rectal bleeding, anal skin tags, and ulcers. In children, Crohn's disease may result in stunted growth and a failure to thrive, even if GI symptoms are not present. In addition to symptoms involving the GI tract, Crohn's disease can affect other parts of the body. Symptoms outside of the GI tract can include joint pain, liver inflammation, osteoporosis, skin problems, eye problems, mouth ulcers, and anemia. Patients with Crohn's disease should expect to lead normal lives in consultation with their healthcare providers. The goal of the healthcare provider is to help people manage Crohn's disease, rather than having the disease manage them. Patients with Crohn's disease should expect to lead skin problems, eye problems, mouth ulcers, and anemia.
Okay. I know you haven't had your inflammation lecture yet, but think about these things. So what, why would, if you had Crohn's, might you have some of these other things? You're not absorbing the nutrients, so which of those would you have problems with? Anemia, osteoporosis. So, what about skin problems? It's almost like, they can get these skin ulcers, and I shouldn't tell you that, because I don't really know why, but they get skin ulcers, like, ulcers on their legs, frequently, and not like the kind you get, they look similar to, not the kind you get from, like, rubbing in a bed or body prominence here or there. What about joint pain? Well, think about arthritis. What is it? It's an inflammatory process. Liver inflammation, mouth ulcers, similar to the skin problems on the legs, and eye problems. Again, we're having absorption problems and an inflammatory process going on. So I just wanted to.
Could the skin and mouth ulcers be related to the immune system that we're
Yes.
getting off?
Yes.
And so, like, it's fighting, like, even the good bacteria that's there as well?
Yeah, it's fighting, because there are mouth ulcers caused by autoimmune diseases like lichen planus and skin problems, yeah. And I meant to say that, so I'm glad you said that. Where's my PowerPoint? Yeah, I forgot that. Let's see, what else did I want to tell you about Crohn's? The inflammation causes a thickened bowel wall, and that's when they can get strictures, and that's again what can cause an obstruction. And they also can get deep ulcerations and fistulas, bowel fistulas. Do you know what a fistula is? What's a fistula? An opening from someplace to another that's not supposed to be there. Right? So that's a common complication. Hemorrhage is possible. You're more likely to see hemorrhage, and I can't remember if Karen's talking about ulcerative colitis. You're more likely to see hemorrhage with that, but you can see it with Crohn's. Severe malabsorption. These people can become severely debilitated and malnourished. And sometimes they have to have TPN, total parental nutrition, in order to get the nutritional support that they need. At some point or another, people with Crohn's usually have surgery. They may have to have a section of the intestine removed and then resected. They may end up with a colostomy or an ileostomy, but they often need surgery. On your assessment, be sure to you need a detailed history. and you're gonna ask them about weight loss, stools, frequency, type, any bacterial infections that they may have had, blood in the stool, pain, fever. Those are kind of things you wanna get in their history. You also need to, do a really good psychosocial assessment. What?
Things that would affect their whole life.
Right.
Can't go do anything because of it.
Well, they can do things, but they really have to plan, and they're guarded. It impacts their whole life, their family, you know, their activities. They work around this, all the time.
It's like that commercial where they're like showing, like planning everything by the bathroom. Like,
Yeah,
okay.
yeah, sitting by the, I'll have a seat, we'll have a table for four next to the bathroom, yeah. But they do need a good psychosocial assessment. Anemia, we mentioned, that's not unusual. And, there are drugs that they can give them. Drugs are not gonna be on your exam for elimination. I don't know what Karen's doing. And, if they have fistulas, they need extra calories a day, but if they have a fistula, they may need to eat at least, or consume somehow, 3,000 calories a day. They need more calories than everybody else at any time. If you know somebody with Crohn's, there's frequent hospitalizations, yeah. And they're miserable a lot of the time, not all the time. Have any questions about Crohn's?